It's a double whammy for the African continent. While the continent is battered by Mpox outbreaks, a report published by the World Health Organization shows that number of deaths caused by cholera are on the rise in Africa. The WHO data shows over 4,000 people died from the disease last year, a 71% increase compared to 2022. The number of reported cases also increased by 13%.
The global cholera statistics for 2023 published by the World Health Organization show that geographical distribution of cholera changed significantly from 2022 to 2023, with a 32% decrease in cases reported from West Asia and Asia and a 125% increase in Africa. This is the first year that multiple countries have reported community deaths, which occur outside of health facilities. In 5 out of 13 reporting countries, over a third of cholera cases occurred in the community, highlighting serious gaps in access to treatment and the need to strengthen this area of response. While Afghanistan reported the highest number of cases with over 222,000, the Democratic Republic of Congo, Malawi, Mozambique and Haiti also continue to report significant outbreaks of over 30,000 cases per country. The global cholera crisis continues into 2024, with 22 countries currently reporting active outbreaks, although the number of cases reported so far in 2024 is lower compared to the same period last year, according to preliminary data. The continent is faced by another crisis, Mpox outbreaks. In a significant step to strengthen and accelerate the response, the Africa Centers for Disease Control and Prevention and the WHO have launched a joint continental response plan.
Director General of WHO has issued an emergency use listing of the vaccines that exist and has agreed that Gavi and UNICEF can start to work together to procure the vaccines. I mean, we anticipate that the regulatory approvals for the use of these vaccines, which have already been approved for use in the US, in Europe, can be quickly organized so that the countries, as they are receiving the vaccine supplies, can start to use them. As far as I know, the DRC has already approved.
DRC, the epicenter of the outbreak, received its shipments of Mpox vaccines from the European Union, consisting of 200,000 doses.
So there are 200,000 doses arriving in the Democratic Republic of the Congo in response to the Mpox crisis. So 2 weeks after the declaration by Africa CDC and the WHO of a continental and international health emergency, we are responding to the need to bring much vaccines that were available in order to vaccinate the at-risk population.
Africa CDC says since the start of 2024, there have been over 5,000 confirmed Mpox cases across the continent, with 643 associated deaths, representing a sharp escalation in both infections and fatalities compared to previous years. The cases in Congo constituted 91% of the total number. Most Mpox infections in Congo and Burundi, the second most affected country, are in children under the age of 15. Africa Bureau, WION World is One.